Hello, my name is Stephanie Aguirre. I'm a licensed clinical social worker with the liver transplant team. In this video, we will talk about treatment options that are available for alcohol use disorder and how to find them. Finding the best treatment option for you or your loved one's alcohol use disorder can feel overwhelming, but our hope is that this video will help guide you in taking the first steps. The most common treatments can be broken down into two groups, inpatient and outpatient. During inpatient treatments, often called residential rehab, patients live at a treatment center for a set period of time while receiving behavioral health services such as one-on-one and group therapy. The amount of time you stay will depend on the treatment goals you and your providers create together, but usually people will remain inpatient for 30, 60, or 90 days. Outpatient treatment is different from inpatient treatment because it allows for you or your loved one to remain at home, and it focuses on services delivered on a set schedule in an outpatient clinic, and in some cases, virtually over a video visit. You and your providers will decide how often these visits will occur. Some common types of outpatient treatment you might consider are partial hospitalization programs, intensive outpatient programs, individual counseling with professional counselors, or a visit with a doctor trained to provide addiction services. For more information about these programs, you can talk to a social worker or access the site included below. Some questions you might ask in treatment might be, what are my triggers for alcohol use? What coping strategies can I use to stop drinking? And what medications are available to help with cravings? For those of you being evaluated for transplant, your transplant team will give clear recommendations on which treatment type to consider based on your alcohol use history and clinical presentation. If you are not being evaluated for a transplant, discussion with your primary care doctor, mental health specialist, or doctor specializing in liver disease like a gastroenterologist or hepatologist would be a good idea to obtain recommendations on which treatment types may be best for you. From here, the search for treatment starts. But what does that process actually look like? Let's break it down together. When starting the search for treatment, there are many things to consider. The most common concerns we hear from patients are about the cost of treatment and its accessibility, which means how easy it is to get into a treatment facility. Fortunately, there are many ways to address this, including contact your insurance directly and ask for in-network behavioral health providers, request a referral from your primary physician, and conduct your own independent search. For the purposes of this video, we will talk about the NIAAA Navigator and psychologytoday.com to help get you started. If you're using the NIAAA Navigator, first use your preferred search engine to look up NIAAA Alcohol Treatment Navigator. Your first result should look something like this. Click the link to enter the welcome page. From here, select the option for How to Find Quality Alcohol Treatment. This will take you to the next page that helps break down your search for treatment into 3 simple steps. 1. Search trusted sources to find providers. 2. Ask 10 recommended questions. 3. Choose quality care. Let's start with step 1. Search for providers. If you scroll down, you'll be asked to enter the zip code of your choice. For the purposes of this demo, we'll be using the UCLA zip code of 90095. From here, you will want to filter your search even more by selecting some of the options listed above. For example, if you're outpatient and have Medi-Cal insurance, you can go ahead and check off outpatient and Medicaid. The name of the facility or organization will appear and should include general information such as their website, address, and contact number. Each result will also have icons that directly correspond to the filter icons listed above. This example shows that there is a hospital inpatient, outpatient services, telemedicine, telehealth, insurance accepted, Medicare, Medicaid, and Spanish services available. While we won't be covering it in this video, step 2 is ask 10 recommended questions. Once you've found your providers, this link gives you tips on how to prepare yourself for contacting these providers and making sure you're getting the treatment you need. And the final step is choose quality care. This step gives you even more information on how to select a good program or clinic if you have a lot of options in front of you. Now let's take a look at how to find a therapist through Psychology Today. First, start by using your preferred search engine and go to psychologytoday.com. From here, you will see this search bar to find a therapist. If you click the drop-down menu to the left, you also have the choice to search for psychiatrists, treatment centers, and support groups. For the purposes of this demo, we'll be searching for a therapist and we'll be using the UCLA zip code of 90095. Once you have your results, you'll see a number of filters to go through, including issues, insurance, gender, types of therapy, age, price, and more. To start, let's go ahead and click on the issues filter together and narrow our search even more. You can expand to show more issues, and you'll see the following list. Recommended filters to use during your search for treatment could be addiction, alcohol use, chronic illness, and substance use. Should you relate to any of the other options listed, such as anxiety, depression, or trauma and PTSD, feel free to add them on as additional filters. Let's try to find a list of providers together now. I'll start by selecting alcohol use and depression. As you can see, a number of providers come up as results. Once you have a list to review, most people want to stay with in-network providers to avoid any extra out-of-pocket costs. This is where you would want to add on a filter for your insurance. You can do so by clicking the insurance option to view the drop-down menu and then choose your respective insurance. Accessing providers is easy. Each result usually includes general information such as the name, credentials, phone number, office location, and provider website when available. You can also message providers directly through Psychology Today by clicking the email tab. Our priority on the liver transplant team at UCLA Health is to make sure you are getting access to all the treatments you need. We are here to support you in your process of recovery and hope you and your caregivers found this video useful.